to talk about our announcement that we're going to add dental care through the Families and Education Levy. So when I took office, we launched what we called our Youth and Families Initiative, and we went out and we held multiple town halls. We spoke to parents, we spoke to kids about what do you need for your kids to succeed. And what we heard really informed what we put into the levy, and the levy has a lot of different pieces to it. We've expanded the school-based health centers, academic interventions for at-risk youth, after-school care. But one of the things we heard was that students needed dental care, and they weren't able to get it otherwise. And that's a big deal, because what we know is low-income children miss nearly 12 times as many school days because of dental pain than children from higher-income families. And you know, you can't learn if your teeth hurt. We all know what it's like to have to go to see the dentist and what that means. So when we proposed a renewal of the Families Education Levy in 2011, we included for the first time funding for a dental care plan. And we're here today to announce that Neighbor Care Health will be our partner to make sure children have access to dental care. So they're also going to emphasize preventative care. They'll educate children and families how to address health problems, and also alleviate pain that distracts children from taking advantage of school. So Neighbor Care Health is going to build on the services offered at their school-based health services, and they'll also partner with Odessa Brown Children's Clinic to offer services to address the problems. So services will include oral screening and exams, x-rays, preventive oral care, restorative treatment, health education, health promotion, care coordination, and referral to community organizations. So it's just another way in which we as the city can help support our kids and our families when they're in school. And with that, I'm going to introduce Pat Sanders from the school district, who is the Executive Director of Health Services.
That's correct. Thank
Pat.
you. Thank you, Mayor. As a representative of Seattle Public Schools, I'm really excited to be here today to celebrate our continued family and education levy partnership with the city and the expansion of health services to our students and families. Over the years, our dental health partnerships have included public health in grade 2 doing a sealant program, Children's and the University of Washington in their pediatric dental program, and the community health centers that have included dental health services as part of their program. In recent years, we've become much more aware of the impact of oral health and the toll that it may be taking on student attendance and the resulting loss of time in instruction. Having the dental services available at our school sites next year reduces one more barrier to learning for our student population. We welcome the enhancement of services Neighbor Care will provide at our elementary and middle school sites. Thank you so much.
Thank you, Pat. I'm Mark Secord. I'm the Executive Director at Neighbor Care Health, and we are absolutely thrilled to be the recipient of this grant support through the Family and Education Levy to extend oral health services into some of our neediest schools here in the Seattle School District. As the mayor said, you can't learn if your teeth hurt. None of us can, and certainly our children deserve better than that. So our goal is starting out one school at a time, and we hope to cover at least 11 schools through this grant support to make sure that when children leave the school, when students leave the school year, they're without caries. We know from our own work in screening our youth in schools that as many as 20%, 19% I think is the precise number, of them overall have dental caries. So dental caries is the most prevalent disease that our children face. So this support, about $274,000, will enable us to provide that array of services, including for the first time on-site services offered through portable dental equipment in the schools. That's going to be pretty exciting because there are some youth, some students who will never be able to get it together to go to a dental clinic, and they don't have a dental home. So it's a way to get them started and right here in the school, improving their oral health. So as we prepare for healthcare reform, Neighbor Care Health is doing a lot of things to extend its footprint. We're expanding our clinics, we're rethinking our models of care, but we're importantly looking at integrated oral health care. And I would like to introduce Dr. Marty Lieberman, who is the dental director at Neighbor Care Health. Before I do that, I do want to thank you, Mr. Mayor, Pat, representing the school district, for your leadership with the levy and with making this possible. We also would like to acknowledge our partnership with Seattle Children's, which is a very exciting element of this work in oral health, and we'll be serving some of the schools that Children's directly provide services in. So without further ado, a few words from Marty Lieberman, our dental director, a man who's actually been providing services in the schools to students.
And I thought I would talk a little bit about how we do it. So like Mark said, we've got expertise at going in there and screening. So it used to be that we would go in and screen in schools and provide education and try and look at what the barriers were to these kids getting care. And we do that at the beginning of the year, and we do it at the end of the year. And you know what? There wasn't a big difference. The amount of decay that was in our schools was essentially the same. We weren't getting any traction. So now, that is our goal. We want to make sure that no child in our schools where we're working actually leaves the school year with decay. So we start by doing the screenings. We do lots of education. We work with the children. We work with the parents. And look at what those barriers are to getting these kids care. And like Mark said, some of the barriers to care are just, there's just no way that these kids are going to get into a dental clinic to get that care. And for those kids, we're here with actually on-site dental equipment providing that care in the school. So we are, we're doing it one school and one child at a time, but we are going to see no child leaving the school year with decay. That's our goal. So thank you, everybody, and we're anxious to answer some questions and actually give you a tour of our facility here.
Okay,
Yes.
Question. West Seattle schools, will this be offered in any of them when you guys start up next year?
Colin, you know exactly which schools we're going to be at?
Go ahead,
Sarah. Sorry, come on.
I'm Sarah Rigo, I'm with Public Health. So we manage the levy health investments, including dental and our new investments in elementary this past year, middle school and high school services.
Why don't you come on up to the mic? It's okay. And then we'll catch you for Seattle Channel 2.
Thank you.
Okay?
Good afternoon. So Public Health manages the full levy investment in health in our school district, as well as some services with school nurses and family support workers. For oral health as being a new program, it's next year we'll be starting services in the beginning of the school year, and the exact schools that we've worked out with Neighbor Care have yet to be determined. They submitted a proposal to us and to the Office for Education to ask for service to 11 schools, and we're going to do our best to understand the resource and how we can distribute that appropriately to those schools or potentially more. So the exact list of schools will be determined very shortly, and we look forward to having Neighbor Care and Odessa Brown help us provide service in many of those locations.
Other questions?
Okay, I got one more then.
Okay.
So again, am I correct in perceiving this is not just for low-income children? It'll be for any students who go to the clinic?
Well, we are definitely going to target the low-income children and children that need this care the most. But it's about looking at the entire school. It's not, while our target is certainly for low-income school, the goal is that no child leaves this school with decay at the end of the school year. And we serve, have seen children and helped provide access to both community health centers in the community, as well as private practices where their dental home is. So it's not necessarily about, it's more about the disease state of the child and less about the income of the child.
Any other questions? Cool.
I can say about, we will definitely target some schools in West Seattle. As Sarah said, exactly which ones and what sequence, we don't know, but we have deep roots here. We operate quite a number of the school-based health programs, and we know that there is terrific need in some of those schools. I know West Seattle Elementary School is one that we've worked with for years, and it continues to be a major, there's a major problem with oral health, with dental disease and caries.
80% of dental decay lives with 20% of the children. Those essentially are the low-income children, so that will be our target.